Good morning. Welcome to CBSN. I'm Contessa Brewer. It's being called historic. A disfigured firefighter just received one of the most extensive full-face transplants in history. Dr. Eduardo Rodriguez led the team of surgeons. It's great to see you today. Explain how monumentous this was.
Well, it's a large procedure, and the reason why it's so extensive and monumentous is the amount of tissue that was transplanted, which includes the entire scalp, obviously the entire face, but more importantly, the ability to restore function with functioning eyelids. And Patrick today can blink normally like you and I do.
When we see the before picture, how he was after the fire had disfigured him, and it was a way that he had lived for almost 15 years, not only with no hair and no ears, and he had gone through all these surgeries just to get to that point, but he couldn't blink.
That's correct. He couldn't blink, and the surgeons did a wonderful job protecting his vision, which is most important. But the eyelids had to be sutured together to protect the corneas. If your corneas are injured, you do not have the possibility for normal sight.
When we see the back and forth, to see how there were just tiny little holes, right, in his eyes before, and then afterwards, we see amazing, this is an amazing face. How far have we come in face transplants to be able to see this?
This is a large leap forward. And when we look at a face transplant today, in Patrick's case, the incisions are all concealed. And when you look at him, you can't tell, other than some swelling, and obviously he'll need some minor revisions down the road. But the amount of tissue, concealing of the incisions, the restoration of normal blink, and putting the incisions in the back of the head where we give him a complete hair-bearing scalp is a large leap forward.
What was the biggest challenge in transferring the face to Patrick?
One of the challenges that we encountered is that the donor did have a craniotomy incision. That looks like a question mark on the side of the head, which was required as a life-saving procedure.
They were trying to save his life.
Correct.
Right.
So he had that incision on the scalp. We were concerned with that incision in position. Could we transplant the entire scalp?
Okay, and Patrick, for his part, he was told ahead of time, this is an operation that could give you a normal face, but it could also kill you. Why?
Well, an operation of this manner had never occurred. Something similar to this had been tried once before, many years prior. Tremendous advances in medicine have occurred, tremendous advances in innovation, technology that allows us to do this procedure reliably in today's day and age. The last patient that had something similar to this died. Having never done this before, it's important that I'm realistic with patients and inform them that I've never done this. You've done a transplant, nothing of this magnitude, but we will ensure that we include every process to make it safe.
And as Patrick is lying there waiting to get this donor face, I understand surgeons had to remove everything that previously surgeons had worked on to give him.
That's correct. So we essentially take it down to bare bones, to the muscles of the face. The eyelids are removed, so at this point, the globes or the eyeballs are completely exposed, so this procedure must succeed.
What kind of risks is he facing now?
At this point, we're out of the immediate concerns. Fortunately, he has not experienced acute rejection episode. We think that that will happen down the road, but he's come this far in 90 days. He's 93 days today, and he's doing so well. A lot of the major concerns have already been, we've gone through them already.
And Dr. Rodriguez, what does this do for face transplants for the future, for people who have been horribly disfigured?
This opens the field to more dramatic opportunities, and it opens the field for people that have severely disfigured, and it's important that we have the appropriate level of care for our wounded soldiers, our first responders, and civilians with severe facial deformities.
Thank you so much for coming on and sharing your success. Congratulations.
You're welcome. Thank you.